Welcome to the reALLERGIES podcast, a show exploring FPIES through real conversations with patients, parents, and clinicians. This episode is brought to you by the International FPIES Association, the leading global advocacy organization for food protein-induced enterocolitis syndrome. This podcast is for informational purposes only and is not medical advice. Always consult your healthcare provider. The views shared are those of the host and guest. The reALLERGIES podcast is proudly sponsored by Genentech, a leading biotechnology company dedicated to advancing science and improving patients' lives, doing now what patients need next. And now, here's your host, Fallon Schultz.
Good evening and welcome to reALLERGIES, the FPIES podcast from the perspective of patient, parent, and clinician. We're really excited to have amazing speakers and guests with us, two of my most favorite people on the planet. I am Fallon Schultz, the founder and CEO of the International FPIES Association. And I am joined today by Dr. Anya Nowak-Wegrzyn, who is Chief of Pediatric Allergy at NYU Langone, and my child, Landon Schultz, 17-year-old warrior, I would say, who has had a pretty significant lived experience with FPIES. We're really excited to have this podcast as a platform to really talk about the realities of FPIES. I think sometimes when we look at FPIES, we see it from a very clinical lens, which could be limiting, or if you're a patient or a parent, the stress of the lived experience. And so we wanted to devise this podcast to show the different perspectives and to bring our collective voices and experiences together to find solutions, to elevate the cause, to raise awareness, and overall to improve patient outcomes. So I'm first going to open it up to Dr. Anya, if you want to tell us a little bit about yourself and, a little bit of the history of FPIES. I think it's important for our viewers to know where this started and where it is, and sort of just kind of how it's still very much infantile in terms of comparison to other conditions.
Well, first of all, thank you, Fallon, for the invitation. I'm so excited to be here with you and Landon. Um, uh, I feel like I've known Landon for a very, very long time now. I am a clinician, pediatric allergist, pediatrician by training, allergist as subspecialty. I also call myself a food allergist because all of my career was focusing on food allergies. And um, uh, FPIES is a form of food allergy, which is non-IgE mediated. And it's like a curveball in the world of allergy because it doesn't present with typical allergic symptoms. So it was frequently misdiagnosed and undiagnosed. I became interested in FPIES long time ago as a junior faculty at Mount Sinai, where my mentors suggested, look into the cases of that really strange, but potentially very severe allergy, to prepare a presentation for the big meeting of our allergy association. So that's how it started, and I really haven't heard of it much before. Um, and it really fascinated me because it was so very little out there. But the FIS history didn't start with me. It really started in the 70s when it was first reported in the literature, and it was an observation made by a gastroenterologist, so pediatric gastroenterologist, who had a series of babies who were, very, very sick. Those were babies who were fed with milk or soy formula, and then they became very, very sick. They were admitted to the hospital. When the feedings were stopped, and they looked so bad that everybody thought they had sepsis, so like very serious infection. So they were started on antibiotics, and the feedings were stopped, and they improved. But then while in the hospital, they were then fed again, and they manifested the same symptoms, like delayed vomiting, becoming very pale, kind of out of it, and also sometimes diarrhea. So that was the first time that it was reported in the literature. But in those times, it was so uncommon, right? Like it was just, a handful of reports. And when you went back and kind of dig dug deeper, you could find some other, it wasn't called FPIES then, but you could find some other reports of unusual but very severe, reactions in babies predominantly. So that's how it started. And then, you know, since we've met and we started looking at this very uncommon food allergy, it actually became much more common. I don't know what it is, but we definitely think that this is no longer a zebra in the world of food allergy and became a important clinical condition. And there's so much more to do to help the patients and have better diagnosis. And I'm so glad that you are talking today and kind of sharing that perspective, how important it is. Just
Yeah.
keep working.
Yes, yes. I think that Dr. Anya quite often underscores she is the queen of FPIES. So it's not just a food allergy. She is the queen of FPIES, and she's really been the champion and the fighter behind this in the clinical realm. And we're so grateful to have her because she, Anya, you've really have shaped the literature, the science, and brought a community together of clinicians that enjoy working with one another, do it so passionately. And I think that that's some of the things that most patients and families don't see behind the scenes. So I'm so glad that you touched on that. And I'm also glad that you touched on that this was, primarily and first reported by a gastroenterologist. And I think that that is some of the stuff that, some of the areas that we're going to discuss in why we end up in gastroenterology instead of allergy, and giving a little bit of education and awareness around that. As a parent, I lived in the dark ages of FPIES. I affectionately call it the dark ages of FPIES. And I remember when Landon was born, I had this beautiful baby who literally was reacting to breast milk, to milk protein formula. And I had nowhere to turn or nowhere to go. And it was by far the hardest thing I've ever gone through in my entire life, because there were moments where I was met with denial of the symptoms, or medically gaslit and told I was imagining this, or was told babies can't vomit from rice, or being told, oh, well, look, he's plump and he's cute, so that means he's okay. And I think that's the experience that a lot of parents have with FPIES, coupled with the experience of adult FPIES, where oftentimes they've either been dismissed their entire life or they have adult onset. And so the efforts in our history in terms of the advocacy portion of FPIES was really born from a sweet potato. It was a sweet potato that launched all of this. Landon had eaten and was trialing sweet potato. He did not get diagnosed until he was almost 2 years old. So he was having multiple exposures, and it was a very different time. I often say that I don't know if it was better to live back then when we didn't have information, or if it's better to live now when we have a lot of misinformation. I don't know which worse, but I do know that it was a very traumatic time in our lives, and I didn't know how to feed my baby, and I really absorbed a lot of that pain and felt inadequate as a mom. I felt that I was failing my son as a mom. And it wasn't until a hospitalization from an acute reaction to FPIES that I sat and I asked the hospital system and the clinicians and everyone who was there, how do I know what foods to feed Landon? And I was told, we don't know. And then I said, well, what's the treatment? And I was told, we don't have one. And I said, okay, well, can you refer me to an organization? And they said, there isn't one. And it was in that moment, I distinctly remember that day, I will always remember that day, that I made a pledge that if someone would help my son, and if someone would help me to figure this out, I would dedicate my entire life, for the rest of my life, to help anyone who was going through this. And that's really the roots of the organization and where we started. And that's our history and our touch point with FPIES. What do you want to share about your history and experience with FPIES?
Well, I'm Landon. I've had FPIES since I was born, so close to 18 years now. Of course, when I was younger, it was definitely hard for my mom because, as she said, I was reacting to breast milk, nearly everything she would feed me as a baby. It was so hard for her to find things to help me live and have a diet, and it was honestly really difficult. But as the years have gone on, a lot of my triggers have started to go away, which I'm very thankful for. And now I could have a lot more things that I never thought I would be able to have. And I mean, even though FPIES has a lot of setbacks with it, I do a lot of things. Like, I'm a 3-sport athlete. Obviously, it's hard for school because you always have to bring your own food. You're not able to eat out with them, which is hard for the patient because, like, you want to have what your friends are having and you feel a little left out. But other than that, I live a normal life. The dietary restrictions are my major setback, but I have a lot of great things in my life.
I love that. I love
Can
that.
I, it's a silver lining because Landon, as an almost 18-year-old, can cook. He can prepare his meals. So, like I mean, I always say there's some kind of blessing, right, in
There is.
disguise when you are confronted with such challenge, and then when life gives you lemons, you make lemonade, right? And
Yes.
we are grateful for your mom for being such a warrior. If I'm the queen, she's the warrior. She's the warrior Xena of FPIES, and because there would be no progress without her.
Oh.
And because of the love she has for you, that's how this all started. You said it was sweet potato. For me, it was
Ah,
oatmeal. The
ah,
first patient that I became acquainted with had horrible reactions to oat that landed him in the intensive care unit. And
yeah.
then he went, so similar to you, right? Like, he went to the pediatrician. The mom took him to pediatrician, and she, after the second reaction, she said, it happens when I give him cereal, baby cereal, oatmeal. And the pediatrician said, well, let's do a blood test for, oat, the blood test we do for food allergies, which measures IgE, antibody to the food. And it was negative. So
All right.
the pediatrician said, no, this is not possible. He cannot have food allergy. And then he fed him oatmeal in the office, and then actually witnessed the horrible reaction, and then was convinced. So I think part of the difficulty with those dark ages, right, was this lack of awareness and recognition that food allergies
Mhm.
come in different forms, and you
Yes.
don't have to have wheezing and hives, within minutes of eating the food, but it's as serious
Yeah.
and potentially, like, can land you in the hospital.
Yeah, and I think that that's what makes this such a difficult food allergy is it can be any food, right?
Right.
So though that presents such a challenge, and while there have been great strides in awareness, there's also still a pretty significant lack of awareness. I know through our telecoaching platform that we offer through the International FPIES Association called Lonnie's Lounge, I meet with families every single week, and I'm still very touched and very moved and in some ways shocked at how difficult it is to find a knowledgeable FPIES clinician and how patients and families are still being dismissed to this day. And I think that is a big part of the reason why we wanted to do this podcast too, is to really elevate the voice and let families and patients know, like, you're not alone out there. We hear you. We're doing everything we can in the background to be able to support you through this. And I thought one of the really nice things that we could talk about when we're talking about whether being a queen or a warrior or making those advancements is, like, what has been done in FPIES, because I think it's very easy as a parent and probably perhaps as a patient, and yes, as a clinician, because I've sat in the rooms with all of you and admire and respect each of you, but I also know that there's this piece of this feeling of we're not doing enough, and then in the patient community, what is actually being done. So I remember the day that I literally hunted Anya down. I will never forget.
I
She's like, I don't remember, but I definitely do. I knew from having a clinical background myself that I needed to go to the literature and to find the superstars and to find the right people to champion the disease, but also, really want to be involved in establishing an organization. And so there was one name that was on every single paper and first author, and it was Anya. And so I attended the American Academy of Allergy, Asthma, and Immunology conference. So if you hear us say Quad AI, which you're going to hear a lot of, between now and our next podcast, that is the Quad AI. And I'm not even going to lie, I followed her all around in the meeting until I could get a moment of her time. Like I did, I stalked you. I'm not going to lie. And we had sat outside. It was in Orlando that year. You had a blue dress on, a bright blue, pretty dress on. And I remember sitting down and saying, like, what do I have to do to get you on board? I want you on board. How could you work with us? And I think that, that was a pivotal moment in FPIES, right? Like I kind of feel like in that moment, it was this union of two women with two, strong perspectives on this and personal experiences. And it was sort of like this merging and this marriage of these ideas and this passion. And from there, it really became this strategic partnership of how can we tackle this from all angles and bring the right people on board and make the connections that we need to make. And so I'd love for you to speak to that portion of the history from your ends and some of the things that we've been able to accomplish. Because I think hearing and knowing that there are passionate people in the background really working hard is what parents and patients need to hear and feel, and clinicians too, because I feel like through our organization, we have so many clinicians who come to us that are equally as frustrated and have anxiety and fear around treating FPIES. So, share a little from your perspective.
Yeah, I think, it's easy to see that Fallon is a very convincing person, and she doesn't take no for an answer, but she
No.
didn't really, you didn't really have to, beat me into that, because I really felt like we touched upon something that was very important. I will disclose that I really hate when in medicine, when we are confronted with something that doesn't conform to the conventional wisdom, then we kind of tend to dismiss it. And then I quote my colleague and mentor Antonella Muraro, who says that children don't read textbooks. So
Oof.
maybe as pediatrician, so they don't know how to behave, so so to be exactly what's published. And you really have to look at the patient and see what's in front of you, and try to understand, right? Not say that, oh, it doesn't exist, you made it up or whatever, right?
Oh, it's like
So
that's the statement that makes us
yeah,
bonkers,
right,
right? And I wonder
yeah.
what that's like, for the patient. Like, I know you've had many experiences where it's like, we don't know if it's this, and then we pull the food out, and then all the symptoms go away, right? And what is that like for you to have your symptoms dismissed?
I mean, it feels pretty great if you don't have symptoms.
No, what we mean is like when, like if you were starting to have a reaction, it was like, oh, let's wait, let's see, let's push through. It's probably not FPIES, and then it turns into FPIES, and what that's been like. Yeah.
Yeah, no, it's definitely not fun, because if like a doctor is telling you, oh, it's just going to go away, it already passed, and then you're going home on your way home from Philadelphia, which is where we go for treatment, and you just start vomiting in the back of your car and you just have to go back up. It really hurts, honestly, like after being told you're safe and then you're not.
Yeah. Yeah. And I love that you touched on that, Anya. It's so true. And it's a thread that runs through, I think, prevalently in this population. So please continue.
Well, no, because I think that the patients are really the driving force for medicine, right? Like that's what we do. So it's just natural that we have to work with the patients and the patient organization, like patient-centered care.
Yep.
And just make perfect sense to combine forces and work together and try just set the stage for research and getting people to join. And but I cannot overstate your role as this kind of driving force and the passion and just this conviction that you have to do something to change the status quo, because it
Totally.
was right.
Totally.
So like ICD-10 code, the guidelines, all of that. And at every stage, I have to say, because you probably also will confirm that, at every stage, Fallon really, gave me the push and like inspired me, because not with ICD-10. It was like, like we need
We have to have this.
we to have to, and why is it important, for
Right.
those, for the audience, is that, that's how we code the diseases. And right now, if we have a name, like it's like a name in the electronic medical record, right?
Yeah.
So, if you want to track the number of patients you have seen with certain disease, or what happens to them over time, you're
Mhm.
using the ICD-10 coding, and there was none for FPIES, and now we have one. And this is because you thought about that we need to get that. And then like we thought about the guidelines, and we were really discouraged by many
Yes.
very
Yeah.
prominent
Yeah.
experts and authorities, that it's not enough evidence, it's not enough patients, it's not important enough. And it turned out that it was very timely, and it just exploded after that.
Yeah.
I don't know,
I
it's
love
like,
that you're speaking to that too, because I think sometimes, having the understanding the angle of, we even have to push within the medical community, right? And I love that you're highlighting that we were met with resistance, and it's not that severe, it's not this, it's not that. And then through the advocacy and through fighting and through listening to the patients and families and cataloging and taking their stories, we now have 3 phenotypes. We now know that there are adults with FPIES. We now know that there's breast milk FPIES. And it took a lot of fighting and voicing. And, from my perspective as a parent, as an advocate, there have been many times, and you've been at those tables, where I'm sitting at the table and I'm saying, there is adult FPIES. You need to listen. I'm telling you, like, we have these patients, and no. And now we know that there's more adults with FPIES than pediatrics, based on, the prevalence data that we have. And sometimes, sometimes we're met with a lot of challenges in trying to advance the disease and trying to get the support that patients and families really need. But it's not something that I don't think we're ever going to give up on. And we just, like you said, we just don't take no for an answer. The ICD-10 code was an incredibly pivotal moment for FPIES in terms of putting it on the map clinically.
right.
But I can say, as a parent, it gave the validation of the condition. I didn't have to any longer explain this gastrointestinal food allergy that doesn't exist and didn't have a code. It gave us power behind our words and our experiences and what we were living through with our children. And now it's indisputable, right? I remember my first Quad AI, so many attendees coming up to the booth and telling me, "Oh, you'll never see one of these patients. Like, you're wasting your time." And having run the organization for 15 years, it's quite the opposite. Now I have clinicians running to the booth. I need help. I'm seeing an influx of these patients. I don't know what to do. There's all different types of FPIES and different phenotypes. And do you have information? And so seeing the tides turning has been really special on one end, but also has presented quite a bit of challenge on the other end, because there's only so much that we can do, right? And we're trying to work so quickly in the background. And I think what helps us to cement the initiatives is that we do have the ICD-10 code and we do have the consensus guidelines.
Right.
So we're not now fighting that we're disputing that this is real. Now we're trying to translate the actual real lived experience of patients and families into the literature, because there's a lag, right? So, and I think sometimes that's what gets frustrating, is when we have publications and we have science and we have documentation. There's Dude.
Is he going to join the podcast?
He's going to join.
Hi, Dude.
Know him. He's
Oh.
Dude joins every single meeting that we have, so it's only right that he's here. But where I get frustrated with clinicians is we are not making this up. We don't get anything out of making these stories up, right? And so, you shared earlier, like, patients having to prove their symptoms. And this is the reality of FPIES is you're met with such disbelief that you have to feed your child, or you have to eat a food that you know and get sick on purpose in order for someone in the medical field to believe you. And having a mental health background and understanding conversion disorders and true Munchausen by proxy and all these, if we were to take the population of patients that we have that we know have FPIES, whether it's physician diagnosed or self-reported, and extrapolate the data that we know in terms of how prevalent conversion disorders are or fictitious disorders, you would maybe see one person. So to assign that label to this food allergy is one of the most discouraging pieces that I see in the management, and having personally experienced it myself. I mean, when Landon was a baby, I was fighting so hard to get coverage for elemental formula and to get him to, a facility that would see him and be able to diagnose him. And I received an anonymous letter in the mail, accusing me of Munchausen by proxy. And for those that are listening that don't know what that means, it's when a parent is literally making up the disease or intentionally harming the child to produce symptoms. And it was really, really challenging for me to have to keep my head on straight and keep fighting in that. But parents aren't making this up. Patients aren't making this up. And I think that you're such a wonderful leader, Anya, in terms of championing this and cultivating and supporting the patient voice, because we don't want this. I know you don't want this. Right? You don't want this. This is not something we want to have in our lives. And that's where shaping the clinical realm is so important. Would you agree?
Yeah.
Yeah. But to be like 100%, transparent, to come to kind of explain the medical professionals, right? Like this is such a tricky disease, right? Like we don't have the test. You have to really recognize the symptoms, and the part of the issue that or a big issue that we still don't have a diagnostic biomarker, right? That would facilitate the and confirm the diagnosis, is because this used to be a disease of babies, and it's hard to get blood from babies to do the kind of broad investigation, kind of fishing expedition, because whatever we've tested was always negative, negative, negative. So there's nothing to put your to hang your hat on. But again, there's a silver lining, because it kind of forced us to focus on the patient, right? That, we would love to have, and there's a lot of effort going into like understanding the mechanism, what's really happening when Landon eats, his sweet potato, or some other food. But even though, and this has been happening, right, like slowly, but we still don't have a test that would predict, before he eats that sweet potato, can he eat it without symptoms? No, we still have to feed him. But then we kind of said, okay, how can we help? What can we do? So I think that was the strength, of having the IFPIES. Like, what can we do without that knowledge to support the patients, and kind of give them the voice, and encourage them to speak up for their kids, and get involved. And so
I hope that anyone who uses this podcast, if they're personally or professionally impacted, when you reach out to the organization, we're really keeping track of what you're saying, and we really do voice what is being seen, because there is a lag. And I know you can speak to this, Anya. I mean, you've heard me like literally go to the NIH, go to the National Institute of Allergy and Infectious Disease, sit down at the Quad AI meetings, travel all over the world and do speaking engagements, and challenge clinicians too that maybe are, oh, there's no evidence on that. Well, there's no evidence just because it's not real. There's no evidence because you haven't published it, right? So it doesn't mean it doesn't exist. And it puts us in such a unique position as an organization to how do we support and help patients and families while they're in the midst of this, when they're reporting symptoms and we're seeing it like, consistently, or we're seeing shifts, just like we saw with the common trigger foods. They have shifted. Like back in the day when, 17 years ago, the common trigger foods were milk, soy, rice, and oat. And then first foods of introduction switched into doing, more whole foods and good fats. And then we saw this rise 5 years later in avocado and sweet potato.
Right.
And then now, we're starting to see a shift into the early introduction to peanut and egg and oat. And I think that without the partnership between the patient advocacy organization and the clinical realm having these discussions, a lot of this would be missed. And, I can't imagine how that must be for a patient that's experiencing it. And a lot of the times, the literature, it supports infant and pediatric FPIES. And just like you said, they can't speak. They can't tell us what they feel and what this experience is like. And so learning from some of the older patients or some of the adult patients or those who haven't outgrown it, I think is pivotal in terms of advancing the disease. I mean, you could probably, if you had to describe to anyone who's watching what a reaction feels like start to finish, like you eat a food, what happens? How does it feel? Where do you feel it? Like, can you walk?
I mean, there's always different kinds. Like some could be earlier, some could be later. But for me personally, I usually start to feel a little, I would say, lightheaded kind of. And then an hour or two later, you'll feel this sharp pain in your stomach, which that's how you know it's coming. And then within 5 to 10 minutes of that, I'm either throwing up, I'm getting hives, it turns from okay to really bad really fast, and it really stinks. Like, you go from eating it and then thinking, oh, not an instant reaction, I'm gonna be fine, and then out of nowhere you're playing games with your friends or maybe talking on the phone, and then you just feel it and something's gonna happen.
Yeah. Do you want to add to that, Anya?
Well, I think that this delay, right? Like the delay and symptoms that are not typical, right? So the delay in onset and the symptoms that are, like this lightheadedness or abdominal pain and the vomiting, right? This is not something that happens in anaphylaxis,
No.
right? Like this happens like that, and then you can get difficulty breathing or you get covered in hives, etc. But it's interesting what Landon said, right? Like we should highlight that is that FIs is such a mystery. Like we really need to study it because we've now understand that patients with FIs may have both types of symptoms.
Right.
Right. So
Right.
they, especially if they're overall like an allergic kind of a person, then you might see that, some rashes with some of the reactions. And this
I'm
is
so
even
glad you're
more
saying.
confusing.
Yeah,
It
but
just
I'm so
gets
glad you're touching on it, because I think that there's such hesitancy sometimes to speak up because it's not published in the literature, right? It doesn't mean that we're not seeing it. And having, comorbidity is 65% of our patient. We have that data. We know that 65% of our patients have atopic disease. But if you really sit back and listen, I can share from my perspective of probably speaking, it was really the adults that put the pieces together for me more than the pediatric patients. And the adult FPIES patients explain the reaction exactly the same. And when we think about research or how we study this, we study the symptoms and post. We don't study pre, what's happening. And it's a 2-hour delay onset, right? Landon just shared, he could feel that it's coming. He knows that it's about to happen. And we're not really looking at what's happening in that window. We're just looking at the profuse vomiting and then, the aftermath of it. But the adults all, I'm saying all loosely, but the majority of the adults that I've spoken to have consistently explained that it is this sense of doom, this feeling almost of like anxiety where something is about to happen, and then pain in the gut, with this contraction feeling of building in the gut, and it contracts and it builds and it builds. And then there's this gush, this warm gush that they feel, and then the vomiting starts. And I think that tells us a lot about this, and that gives us some clues of how to research it. And this is a pediatric patient who has grown through the years, who's describing it now exactly how the adults are describing it, because he could verbalize it, right? It matches. And so, you know, when we're thinking about unmet needs and we're thinking about gaps and we're thinking about future directions, I'd love to hear from both of you your perspective of what you really think the biggest unmet need is, and where or how we can intervene with this to provide some solutions to really represent the patient experience.